Hello, please subscribe and like for our channel. Thanks very much. So we are going to continue the short cases by speaking about the modalities of the treatment. Is it clear? You need to know that modalities of treatment are actually the means of management. And now the means of management, you have three major means of management. You have the first one, the general means of management. The second one is pharmacological means of management. And the third one is interventional means of management. Or you can still say the first one, general means of management. Second one is medical means of management. And third one is surgical means of management. Now, you have to know that what in this case, you're going to have two major means of management or modalities of management, which are the general and the medical. As general means of management in this case, you realize that the patient is having a raised intracranial pressure. So you are going to position the patient in a semi-seated position in order to reduce the raised intracranial pressure. Are you understanding? So that is one general means of management that is going to be very expensive, that is going to be very useful in this patient. Is it clear? So you're going to sit the patient in the patient should be in semi-seated position in order to reduce the raised intracranial pressure. Is it clear? Because the backflow, when the patient is lying down, there is backflow of blood and it is going to be reduced CSF draining into the system. The second one is the medical means of management, the pharmacological means of management, where you are going to use now antibiotics and you are going to use steroidal anti-inflammatory drugs. Is it clear? The antibiotics now to do what? You don't need to write the specific antibiotic in a short case. In short case, just write antibiotic therapy under the means of management, and you write also steroidal therapy, steroids. Is it clear? Steroids in order to reduce the raised intracranial pressure. In addition to that, if you want to reduce the raised intracranial pressure, you can also add also an osmotic diuretic. Example is mannitol, but there's no need to put the obviously put the particular drug. Are you clear? Is it clear? Now the next thing is question 5. They say give two complications. So I'm just going to give you the array of the complications of meningitis. Is it clear? They have said two. Generally, the complication of meningitis is divided into two. We have the short-term complication and we have the long-term complication. Now, for the short-term complication of meningitis, we have the local complication. And now, among the local complications, you have what? You have a brain abscess, you have an empyema. Is it clear? You have brain abscess, you have empyema. Is it clear? And you have also raised intracranial pressure as complication. Now, as systemic short-term complication, you are going to have what? As systemic short-term complication, you are going to have what? You have sepsis, you have septicemia, you have septic shock, you have acute kidney injury, and you have all the things you think under the short-term complication. Now, the long-term complication. In the long-term complication, you have 10 major complications divided. As general part of the brain, you have hydrocephalus, you can have epilepsy. Basically, you have hydrocephalus, epilepsy, you are going to have a motor impairment, you have sensory impairment, you have visual impairment, you have hearing impairment, you have ataxia or balance disorders, you have subdural effusion, and we have a syndrome of inappropriate antidiuretic hormone. So those are the different complications that you have in this case. Now, the next case is a case 2. So case 2 talk about a 28-year-old female presents with hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook all this we have on the no contact 652 659429. Thanks very much.